Sure. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Motion by Salinas.
Evening. Sure. So, assessing and managing suicide risk is a 1 day training, and this is a training for our clinicians. It teaches them how to recognize, how to assess for signs of suicide and manage suicide. It's an additional training. This is a training that fulfills some of the requirements that we need for CCBHC, for our zero suicide philosophy, also fills in different gaps, including meeting standards for JACO, for the National Action Alliance for Suicide Prevention, Substance Use and Mental Health Services Administration. So it fulfills a lot of requirements for us, as well as system-wide and for different accreditations. It's also tailored toward veterans. So really, it's a very thorough training. We have a trainer that we send to cut down on costs. So we have an in-house trainer, Laura Hitzerberger, from our training department. She will be doing the training, but the evidence base of this training, the model follows that each clinician who is attending this training has to have a book. So these books are for each clinician who will be attending. Sure. So this is a training for master's level licensed clinicians. We have a training for non-clinicians or non-licensed staff. That's QPR. And that's another suicide training. This one is strictly for our master's level clinicians, and it will be open to our contract and direct clinics.
How you doing? This is basically just a request for approval for myself to attend 2-week colleague training in St. Louis, Missouri Independence Center. This is part of our Clubhouse International Accreditation Standards that we have to attend those to a 2-week training. So we're just looking for permission to allow myself to go there from June 19th to July 1st.
Yes.
You're up. So as you recall, you gave me permission to issue the capacity building grants. This is the first one to come through. So internally, we reviewed it to make sure programmatically that we were in support of this expansion of services, and we are. And then we also reviewed it with finance to make sure that we did have available funds and a fund source to support this appropriately, and there was. So this one is specific to quality care, and they're looking to expand some of their current office space to accommodate more people for their ABA services and occupational therapy primarily.
Hello. Many of you probably haven't met me yet. I am Christine Brothers, the Director of the Managed Care Operations Department. So this proposal, we are looking to bring in the outside assistance of Chris Elias to assist in developing the strategic plan for our department. He will assist us in setting long and short-term goals to move us forward as we revise and develop our procedures to institute better controls, utilization management, and the overall functioning of the department. In addition to the strategic planning element, sort of the heart of this proposal is actually the work that Chris will do with our team on leadership training and team building. He'll be working with us on a variety of areas such as optimizing productivity, building accountability among the management team and staff, providing effective teaching the management team, the supervisory staff, things such as being able to provide effective feedback to the staff, healthy confrontation, goal setting, a lot of other leadership and supervisory areas. This partnership with Chris will be an investment into the supervisory abilities of my team, and it will result in the refinement of their supervisory skills, increased accountability, increased team building, staff retention, and sort of the overall stabilization of the MCO department.
Thanks, Dana. Hi, Christine.
Hi.
I see that it's for a year. Is this something that could be extended if needed, or is really the program just for a year and that's kind of it?
It could be extended if it's needed after that point.
And would the cost be the same? Is there a little bit of a discount since we did the year? How does that work? Do you know?
That piece I'm not sure on.
Okay.
He only quoted out for the first year.
Okay. Thank you. Thank you, Madam Chair.
Yeah, I was trying to get the microphone on. This was my brainchild. We continue to struggle a little bit with membership and participation levels at our CAC. The folks that we do have attending are great, and I'd like to thank them all. Hopefully, my idea was if we gave them a little stipend, it might help our attendance and the level of participation. Our goal for the CAC is really, for them to become self-governing to some point, that they would be bringing issues forward. Right now, it's more, me sharing updates with them, Linda sharing updates with them as the board liaison to that group. This group has also agreed to support our CCBHC efforts. It is required for that program that we do have the input of people that are being served, have been served through our system. So it's an important aspect of our infrastructure. They do review our marketing information. They look at our quality assurance performance improvement plan and our annual plan, provide feedback like that. So the board action is to provide them a $50 stipend specifically for their attendance at it meets every other month right now. They do, like I said, assist us in reviewing some things in between those meetings, but for sake of bookkeeping and tracking, if we just did it for meeting participation, I'd like to see if it has a positive impact. And I did check with finance, and we did have, that was an appropriate use of our funds. We're Zoom right now. We, at the last meeting, there was, we are moving to hybrid, I think, for our next meeting. Yeah, we do have some folks that are working, things like that, so it'll make it easier for them to attend, but we will be holding it in our main conference room at the. Yeah, but again, to increase the level of participation, we want to make it as easy to attend and participate as possible. Right now, I think we have maybe 4 or 5 approved members that are actively participating. We do have people who have showed up to observe as guests, and then some of them have made the transition to a full official member, which comes up to this board for approval of their membership.
So I'm just kind of.
Well, we'll present that to you when we present candidates to this board.
Thanks, Dana. Dave, what pot of money does this money come from? Is this general fund or is this something else?
Not general fund.
Administrative, okay. Thanks, Richard. Thank you, Dave. Thank you, Dana.
Request to move to CMH full board. Motion by Antoinette, support by Lori.
Again. We changed one of our policies, which was specifically referenced in our contract boilerplate language. So with working with legal, we've amended the policy and changed the contract language. It used to speak directly, specifically to providers of appeals, and it's more accurately just reflected as dispute resolution process. We do always value, and want to offer our providers the opportunity to express dissatisfaction or concern and to be heard. But the appeal process is more formal to the people we serve through the Medicaid fair hearing when we give them official notice of reduction, suspension of service.
myself and a special guest. Yeah, so this was born out of our policy administrator coming to me and asking how she could make her job more straightforward in terms of, we have a huge policy manual with, I think, well over 100 policies. Yeah, probably about 200 policies. And every year those need to come up for approval and they need to be reviewed by department heads, sometimes people outside of the organization, sometimes with the state. And currently that's really done out of the goodness of Brianna's heart and hard work. And she wanted a system to be able to manage that stuff better. And so we picked a system. We had some requirements as far as what the systems that we were looking at. We wanted to find something, where for internal people, they could use their single sign-on, where we're able to, basically beyond the people that are administrating the service, that we would be able to have unlimited logins to it. So if we needed to engage with a provider agency, any of that stuff, that there wouldn't be a limitation in the amount of people that could use that system, and needed to tie into our Office 365, all that stuff. And then from that, we realized we were kind of going down the road of having a comprehensive risk management system. And so we looked at contract management as well. And that kind of ties into what Dave was just actually talking about on the last item, where you have a change to the boilerplate and you need to be able to communicate that out to the providers, and that may constitute a change in policy as well. And so you link those contracts and policies together, and having a system that does that and sends it through the chain of approvals and all of that and communicates that out would be really beneficial for making the best of the resources that we have at CCMH. So that's why we're looking at this system. I brought Tony in case you guys had any questions more specific to the contracts. And he graciously volunteered to answer any questions related to the contract management piece of this.
I can even add a couple things if
Sure.
you don't mind. I can't pass up an opportunity to speak before this board, my first chance. So one of the important things in collaborating with Thomas and bringing the policy together with the contracting, there's always a financial component to that, and that's where we come in. So just a couple highlights of what we'll be able to do by using this system that brings it together. First is accurate payment and error avoidance. When we have access to the actual contract language, if our AP staff has a question, are we paying the most current terms or rates, we can structure this so they can have an access to that and see in real time that we're paying in accordance to the most current contract. That's an example. Another is improving efficiency and for example, rate analysis. We do a lot of work when we have to analyze our contracts rate with providers. Right now we can do it, but it's not the most efficient, sometimes not the most accurate. This will again give us the ability to quickly pull that data into our analyses when we're presenting those rate increases. And then just general process and efficiency improvements for the finance teams. Things even as simple as a central repository of where all of our contracts are. So when it comes time for audit or review, we all know where they are, or something as simple as notifications when we have expiring contracts. We'll know then on the payment side, we don't pay that vendor because the contract ended. So just a few examples of how we can bring these two things together and support not only the risk management of the policies, but also efficiency in the finance area. Any questions that I can answer for the group?
That's correct. Yeah, 36-month term. So we compared several different platforms for this, and all of them, well, at least the initial one that we looked at, they were kind of locked into the 36 months. So just to go apples to apples, we basically based all of the evaluations off of a 36-month term. So that's the whole reasoning there. Yeah. Yeah, it's pretty standard for the risk management, because they want to work with you over a longer term to make sure that you're building out an effective system for doing it. And so there was none that were really structured around a 1-year standalone agreement. On that note, the system that we picked, we own the data. So essentially, like if at the end of the 3-year term, we want to pull everything out, like it's already existing in our systems. We don't have to go through a whole thing of kind of extracting back out of that company and moving into something else. That was a very important thing for me, because I don't like it when we're just handing off everything. So. Anything else? Thank you.
Request to move the CMH airfoil public relations.
Yep. You gave me permission to issue an RFP for a marketing public relations firm. So we went through the RFP process. We selected Airfoil. They've supplied their basic contract boilerplate, and that's with legal right now for review. If you recall, it was an RFI with a not to exceed amount. So this first part, this will be a phase one, which will allow them the opportunity to get to know us, spend some time with us, and then start to develop the longer-term marketing plan, which would be the phase two contract that would then come back to this board. We are currently without a marketing communications director, and Tracy will testify that we need support in this area. So we're looking forward to being able to start working with them.
I'm not sharing, so I got to ask a lot of questions. Dave, how many, off the top of your head, do you know how many responses we had to the RFP?
Yes. A bigger number, give or take. And national firms did apply, which was a little surprising. But yeah, when we went through the RFI committee, which is Agnes and Tony are part of it, and Christina, myself, Tracy, did you? Yeah.
Thank you. Thanks, Dana.
Oh, lots. I shared with the board and with the leadership team meeting, and it will go out in wider distribution, but our community needs assessment will be a starting point. I've been approached by other media opportunities and things, but we're not quite ready to share any high quality information or graphics and things. So we're kind of pushing those off until we have this agreement in place. We're working with them. The other big piece is that a longer term plan that's inclusive of the reaching all parts of Macomb County and using all available and appropriate platforms. I don't know if billboards are the best means of advertising right now, but they should definitely be able to help us on the social media front, and then being able to track those hits so that we can see which ones are, we're getting the most bang for our buck. So it'll be, they'll produce for us and with us, a detailed plan kind of by month and by quarter for the future period of time. But the needs are great. We have the Sheriff's Department. There's a simple little pocket guide that it's been on my desk since Lieutenant Gillespie brought it over, and on Tracy's desk, and we just don't have the resources right now to get it updated and get it off and printed. But and the legislative packets that Phil so kindly took up to Lansing, Tracy did all of that, basically.
Yeah, just to jump in, I'm your graphic designer and your social media manager and your chief of staff and that's not a good plan.
She did a great job. I think we should give her more to do on that front. can really save a lot of money by just having Tracy do all of that. But for Tracy's sanity and stuff, we do need support in this area. It came out very well.
Can I share an anecdote
Sure.
on that line? So
Um,
not that long ago, we had somebody our veteran navigator reach out to me because much like Tracy, we take on the jobs that we need to. So I do a lot of the website updates, and she reached out and she said, "There's no veteran navigator page on the website." And so I spent an afternoon working with her, putting something out there, and then that same day, she gets a call from 2 veterans saying, "I found the information about the veteran navigator on your website." So working with somebody like Airfoil or anybody else to get that stuff out there, get it in the right places, has a very real impact on getting people that need services that might not know about us into services. I just wanted to come up here and say
Thank
that.
you, Thomas. And
Yeah.
apologies to the chair for me speaking out of turn and granting him permission to. Sorry.
Apologies. I just know people like good news.
Yes, thank you. I will also share, I have, my notes and my to-do list. My thought was, when we're talking about increasing access to services and, reducing the stigma, increasing our presence and awareness in the community, I thought it'd be really helpful to have information about what to expect from our system and what that first meeting looks like, or the first 30 days kind of looks like. So working with a firm like this, we could do a short animated video that kind of explain things. We could have it in our lobbies running on TV screens. We could have it on our website. It's things like that about looking at areas in our system that are complicated. I get calls from and emails from parents about our family support subsidy program, which is, it's a small thing that we do, and we have a staff person who does a great job coordinating all of that because it's not really highlighted on our website and things. So it's using the technology to its fullest extent and the videos and graphics, and looking forward to this opportunity.
Support that, Selena.
Oh, I'll kick it off, and yeah, Richard, you can come on up. Yeah, I don't know how much Richard has, we're in conversations with the state of Michigan right now over the exact amount of money that we're able to put into our internal service fund. And what we need is an actuarial firm to do what they do to tell us the amount of money that would be appropriate for an entity like ours to have in our reserve pools.
Yep.
What I do, Richard.
So the short version of this is that under federal regulations, in order to put money into an internal service fund, we do have to support that with an actuarial evaluation that happens at least biannually, so every other year it is required. Based on which we'll talk about during my CFO update a little bit. The current balance of our internal service fund is a little over $37 million. So this approximately $20,000 will help us be allowed to retain that money rather than have to give it all back to the state of Michigan. So money well spent, in my opinion, but obviously for your consideration.
It's a good way to put it.
That was gonna be my question. Do we vote on that?
No.
I'll make the motion to receive them.
I'll
Phil.
support that.
Thank you, Phil.
Through the chair. The state puts our CMH contracts, our substance use grant work through egrams. Our PHP contract goes through a different system. So what happens is we get email alerts that, hey, you need to sign this and you need to sign it quickly. And that does not always coincide with our board schedules and things. This one is a smaller amount. What it allows us to do is, because I spoke up in a meeting a couple years ago, we now have funds, $58,000 now, for the licensing agreement with Azara. Azara is the electronic health record, medical record, that the federally qualified health clinics use for their information and their population health platform. The state was piloting this, so we're part of the expanded pilot now, but we're still one of the first counties in the state they're working with PCE, which is our electronic health record vendor, and Azara to share information better together, to go back and forth. So now we have access to physical health information when the person's seen in the FQHC. So when we're looking at some of our care coordination and integrated healthcare efforts, this is a really good thing that we can then build. So it's been kicked off. There was how long was that meeting? 5 hours the other day?
Yesterday, I can't.
Yeah, he was. I get accused of having a monotone every so often, but his was really, it was hard. Yeah, but it was very detailed, and we'll have access to some really good information. And then actually tomorrow there's another user meeting for this platform. So again, it moves us up at the state level into our use of integrated healthcare and using data to really track and hopefully show some positive outcomes for the people that we're supporting. So we signed this, the Office of the County Executive signed it outside of our board session. So now it's being presented so you know that we did that.
I think you do have the resolution that explains the individual's history, but obviously she's a long-standing team member. And as you can see, she's actually kind of been promoted throughout time and actually started as a job share in one of our locations. So it's a great example of a successful career, and we're extremely appreciative of everything that she's done. Of course, we don't want her to leave. We do have a party. It was announced in the workforce update for several weeks in a row. I just took it out in the most recent one, but if you are interested to share your best wishes, that would be the way you could go about doing that.
Well, good evening again. We're going to keep this one relatively brief, but we did want to give an update to the committee about kind of where we ended fiscal year 22 and a little bit of the background there. You will see a regular financial report at the board meeting this month with the finalization of the reports that went to the department last week. We did hit that deadline, thankfully. We now have the ability to update our beginning balances in the current fiscal year and roll all that forward. So excited about that. The handout that you have in front of you really is a comparison of some of the, what I would say are the more important balances that we see at the end of each fiscal year and comparing them to what we did a year ago. So comparing 2022 final to 2021 final. The first one here is we did show a little bit of how our Medicaid and Healthy Michigan lapse was in 22 compared to that prior year. So just to quickly, 62 million lapse in the prior year down to 24 million in the current year. So some of that spending plan that we did implement during the course of the fiscal year did help that quite significantly. I will just put a little bit of an asterisk on there. We're going to talk about that when we get to the ISF balance at the bottom of the page. Some of that we did not lapse, we didn't lapse because we did put it into the internal service fund. And so we will talk about that in a little bit more detail. The next section is new, and so you'll see that there is zero balances in the prior year. It has to do with our CCBHC program. So because of how our CCBHC program is new in 2022, we did have new balances that we would have with the state of Michigan. So on the Healthy Michigan side, we did get more funding than we needed, so we have a little bit of a lapse there. But on the Medicaid side, we did not get as much as we needed, so they actually owe us money. So kind of on the other side of that coin, we're giving back some regular Medicaid, but we're getting some CCBHC Medicaid. So that's some good news. And again, we'll talk a little bit about that as we get to the bottom of the page about what that does for our local fund balance as well. So that's good. And then if you look at, there is a GF lapse section. So we did make some improvement in the GF lapse. We were at close to 4 million last year. We're down to about 3.8 million at the end of 2022. So we did make some incremental progress there. And then just a reminder for the board that one of the reasons that we are lapsing so much GF is because we do not have individuals that are on spend down currently. And as the public health emergency ends, that spend down will become a liability that we are required to cover with our general fund dollars. So we do expect to see that to reduce again in 2023 with the end of the public health emergency, and even more so in 2024 since that public health emergency will have been done for a full fiscal year. So in general, kind of big picture from a lapse perspective, 66 million we lapsed in 2021, down to about just under 24 million lapse in 2022. So I guess an improvement, depending on your perspective, of about 42 million. At the bottom of the page, then, we wanted to give you a little bit of a feel from what the ending prior year balances were that we get to roll forward. So for CCBHC dollars retained, that's a new program again. So there was zero in 2021, but we actually had a net surplus of $7 million. So after all of the CCBHC revenue that we received, all of the expenses were calculated out, we did keep about $7 million surplus for 2022. So that's good news from a financial sustainability process. We are in the process of calculating our new PPS1 rate for 2023. So interestingly, because of how the state has the process set up, we're already close to 5 months, 6 months into the year, and we only now will know what our new revenue number is going to be that we've been operating on for the last 5 months. So we do expect that number will be around the same number that we had last year. We do expect that the number of services we provide will be more in 2023 because we were kind of in a little bit of a ramp up phase in 2022. So we do expect that revenue will actually go up from 22 to 23. So that's good news. On the other side of that, though, as we're ramping up services, that means expenses will likely go up as well. So we hope to be able to project sometime this summer, where we think we'll be in terms of revenue over expense. So the next item on the bottom there is that internal service fund balance that I mentioned. And as you'll see, we put an extra $18.5 million into the internal service fund for 2022. I just want the board to be aware. So we are in a little bit of a contract, I'll call it a dispute and resolution process with the state of Michigan. They currently are indicating that they don't believe that we are allowed to put this $18 million into the internal service fund. However, after a few emails, they've been unable to cite contract or federal language that says we cannot do so. So we continue to push that issue. We will continue that discussion. But again, the analysis that we're requesting from Milliman, as well as continued dialogue with the state, I'm hoping that we'll be able to convince them that that $37 million balance is not only acceptable but appropriate given our future risk. But wanted you to know that if at the end of the day we were to be found to be inaccurate in our interpretation of the contract language, we may have to return that $18 million. So I just want you to be aware of that potential risk that does exist. So the next item is for Medicaid savings. Medicaid savings is retained based on a percentage of our contract. Our total revenue received from the state actually went down ever so slightly from 2021 to 2022. So our Medicaid savings as a percentage of that also reduced slightly by that $390,000. Our PA2 fund balance, or again, that's sometimes referred to as the liquor tax that we receive, half of from the county's general fund. We had about $2 million of that remained unspent at the end of fiscal year 22, so we are allowed to retain that on a going forward basis. In case it has not already come to your attention, that there's actually been a change in the law at the state level that will increase the amount that would be distributed to counties. So we will see an increase in the PA2 that's distributed, and the funding formula of how much has to get passed through to us is also changing slightly. So we should get a better idea of what that looks like in future financial statements, but that is a pending change right now. So. And then finally, our ending unrestricted fund balance did increase almost a little over $11 million. Part of that is the CCBHC dollars of $7 million that we get to retain. So that is included in that $11 million also. But we wanted to break it out since it was a new program so you could see it separately. The other $4 million is made up of a couple different things. We do get a performance-based incentive payment from the state of Michigan every year that we're allowed to retain as local. That's between $1 million and $2 million every year. Then we have other withholds that we get from our opioid health home program and some of our other quality withholds that we get to maintain as well. So all of that kind of feeds into that increase. So in terms of then reserves that we have, we're looking very strong with, I mean, if we get to keep that 18 million in the internal service fund, which I'm fairly confident that we will be allowed to do, we are at close to $100 million of reserves available. So we should be able to be sustainable for quite a while. So excited about that. Any questions or concerns? Megan?
Push this, sorry. Richard, remind me, the ISF, is that restricted money that can only be used for specific stuff? I feel.
Yep, so when we put the money into the ISF, it does retain its Medicaid flavor, and so we can only use it on Medicaid, allowable costs.
Okay,
Yep.
thank you. I remember that there was something. Thank you.
Yep.
Thank you, Madam Chair. Richard, the 37 million for the ISF ending balance, I feel like that's closer to the number that in my mind means it's fully funded, not the 18 million. And I thought over the last year or so we've had a fully funded ISF. Can you explain what am I missing? There's something that's not connecting here.
So fully funded based on, so this is kind of the question that we are now debating with the state. We were fully funded based on what the state's interpretation of the contract language was. We are now fully funded based on what our interpretation of the contract is. So that's really the difference between fully funded then and fully funded now is how you interpret that contract language. And we're feeling pretty confident that we are interpreting it accurately. So that's why we get to put that extra 18 in.
Okay, and basically if we do lose out on this and the 18 million does have to go back, we still trending towards our goal of lapsing less back because the prior year was at 66 and this would put us at 60-ish even. So we're, even with that, as bad as that would be, we're still trending in the right direction for that ask, I guess.
Yes, that's correct. So if you take that 18 and put that into the current year lapse of 24, right? We would have been at about 42 compared to 62 in the prior year. So about a $20 million improvement, even that considered. Yep.
Thanks, Richard. Thanks, Madam Chair.
If I can get this to work. It's on, okay, yeah. Back to I don't know if you can address the Milliman issue and the actuarial. Are you currently in the process of getting the actuarial, or could you kind of expound on where you're at with that whole process a little bit?
Sure. So first, we do have to get the contract or the engagement letter signed, so we're waiting board approval for that. I have been through this process with some of the other PIHPs as well, but we are gathering the data that we need to provide them. So we are required to provide claims level data for the last 3 fiscal years so that they can get a trend and see where is our healthcare costs trending, where does it look like we're going from a risk perspective. They do put some assumptions into that analysis, like where do we think revenue is going to head in the future, which we know the public health emergency is ending. We know eligibles are going to go down. So we do know revenue is going to go down. So they will build some of that into that assumption, some of those assumptions into the analysis. I would hope that if we can get that approved and signed close to the end of this month, their process usually is 4 to 6 weeks to take our data, analyze it, and come up with at least a preliminary result. So we'll be ready to hand that data over as soon as we have a signed engagement letter. So, absolutely. All right, thank you.
Try not to lose my voice. I guess I should start with thanking our finance team too. The number of reports that were due by February 28th. I think they gave up sleep and any family time whatsoever to meet all of those deadlines, but we did meet those, so thank you very much. Lots of little updates here. Thank you for approving to move to the full board the quality care capacity building grant. We have a number of other proposals that have come in, and again, we'll be reviewing them programmatically to see if they're value added and if we would support them, and then having them go through finance. Because we missed bringing a number of those to this committee, that would put them off until the end of April. I'd rather not do that. So I will be asking your permission to hold a special board meeting once we have a date that we'll have all those reviews completed by. And the agenda items would be those capacity building grant that were submitted, and those providers who submitted them would have the option of showing up as well to answer questions. So heads up for that, or apologies, or sorry for that. On a related note, we might be able to get this on a special board meeting agenda. Earlier today, Helen and I stood at that podium, so I was on the other side, and we presented to the Health and Human Services Committee of the Board of Commissioners. So thank you, Phil and Antoinette. We gave an update on kind of the state of community mental health in Macomb County. And it had been triggered. There was an article in the Macomb Daily about a local nonprofit who was supporting about 60, 70, I guess they're up to 72 people now, mostly with some involvement with the mental health issues. But they were a little non-for-profit on their own, and they were getting into a tough spot where they would not be able to make rent. So Commissioner Brown sent that over to my attention, and then in the same time invited me to come over and update the commission on kind of what's going on the mental health side. Unbeknownst to me, so my staff went out earlier on March 6th, Christina and Andrew from Network Operations, and met with Nicole Jones, who's the executive director. Some of the other commissioners were at that event as well. And they called me right after, and they were pretty excited. They're like, you know, there's a lot of opportunity here. They don't fit right now into any of our specific service models, but they're really close to fitting into a number of our service models. So we're going to be working with them. They are currently supporting some number of people who are currently already in our system. So for that reason, and because of their financial situation, we will be moving to an expedited contract of an urgent nature so there's no interruption in their service delivery. What I didn't know is after Helen and I gave our presentation, they were here and they presented right after we did. So then I had a nice hallway conversation with them, and there's a lot of real good energy there. So we hope to have an agreement in place. Once we have that, then they could take advantage of our capacity building grants, because we do obviously have a need for some of the things that they're providing in the area that they're providing them in. So I'll keep you posted on that. They're called Preserve Independence, by the way, and Nicole Jones is the executive director. I did share our community needs assessment. Pretty happy with that. A big thank you to Health Management Associates who put that together. I've already talked to them about next year. We do need to, the sample sizes were obviously not where I would hope that they would be, but the information is still good and useful. So we will be going through that in detail. Another good thing as we went through, of course, when they talked to people, there's issues, concerns in these areas. But a lot of those areas were things that we had already put some activities in place, made some changes. So they allowed me to, we gave kind of a response in there to make sure it's representative of current activity. But this will, again, be a good guide for us going forward and help us with our outreach efforts and our network adequacy efforts. Save the date. Do I announce that here, or will I get in trouble from saying? Oh, Tracy's doing it?
You can, they actually received it last time, so as a friendly reminder, save the date. The hope would that you would all attend, yes, and support the Mental Health Awareness Celebration and Award Ceremony. Next steps is you're gonna get an invite, because that was a save the date, but the invite will also have the nomination process and the various types of awards, and Dave will be reaching out to you, kind of getting your feedback so we can hopefully finalize what those awards are called and kind of what the parameters of those are. And then the public, anyone in the public, we're gonna post on our website. I haven't talked to Thomas yet, but the links to nominate. So anyone could nominate an organization or an individual for those awards, but due to the limited space availability, we won't only be able to invite so many people. So we'll work on that, getting that information to you as the next step. So he's seeking your feedback pretty quickly so we can get it out hopefully beginning of next week, because they have to submit by May 1st, which is not that far away. So we're really only giving them 6-7 weeks to nominate people.
And a big thank you to Tracy again, who's wearing all of those hats.
Also the vet planner.
We are actively, you all gave me kind of a nod of approval to work with an event planner, PDQ, so we could put this together. And it was a lot more difficult to find somebody than we would have expected. Tracy has some active leads right now, so we hope to have some help to help us go through the remaining details for that event, because we do want it to be, very nice across the board. Thank you, Tracy. Board of Commissioners. I believe I notified you June 14th. We're expecting a visit from Farrah Hanley. She has been touring all of the PIHPs and regional entities, so that will be her time here. So we'll be putting together an agenda of topics that we want to share with her, and programs and things that we want to highlight. So Bruce, heads up. Stacy Coleman, actually today was her last day, so we had a little send-off thing at noon today for her. So just an update to the board that we will be recruiting and hiring a chief quality officer and a chief privacy and compliance officer. We are, Jim Losey he was still working with us a little bit as a, well, not as much recently, but now he's agreed to help us with some of our compliance activities. And then we do have Brianna and Megan in quality. We chatted with them today, and we'll be meeting with them to set up some more reporting structure detail. So that's a couple more hats that Tracy and I are wearing. We still are interviewing as well for Crystal's position as our Director of Community Behavioral Health Services. We had a interview scheduled for today, which will be rescheduled, and so that one is currently active as well. Oh, Richard touched on it, the ending of the public health emergency, and I did update you that President Biden, at the end of last calendar year, decoupled the continuous Medicaid enrollment from the public health emergency. We didn't hear anything from the state of Michigan for what seemed to be a very long time, but information is now coming out on a pretty steady basis. There's been some commercials notifying people that their Medicaid, continuous Medicaid enrollment is coming to an end, and the steps that we need to take. So as I get that information, we are sharing it with our providers. It's going out in our workforce updates and things like that. So we hopefully, we won't have too many people impacted by that. The other good news on that front is it'll start in June, and it'll be for the people whose annual date for Medicaid enrollment is in June. So it'll continue. It's not a cliff for everybody, because the state would have a hard time handling all those numbers and stuff anyways. So it'll be month by month based on the date of their Medicaid enrollment. So we'll continue to share that information and work with the people we serve and the staff to try to make sure everybody's as informed as possible. And that report.